what we are suggesting is that at the heart of the statute is an overarching principle, and that is that all decisions that are made have to promote or contribute to an individual's well-being. There is not going to be any statutory definition of what is well-being, but it will be measured by the 7 factors that you can see on the slide, and they are important. So if I just dwell for one moment on them, they are that the person is to be the best judge of their well-being, and it follows from that the decision maker must follow that person's views, wishes and feelings where it is practicable to do so. The decision which is to be made is not to be based on a blanket assumption, well, this is what we always do, but to be individualised in relation to that service user. The whole system is one which should involve the individual as part of the decision-making process, but clearly where there are carers involved, there may need to be a balance between the interests of the carer and the interests of the service user. And so that is the reference that you can see as to the balance with the well-being of others. And it may be also that when you're dealing with a family situation, taking into account the holistic approach there, that although not formally carers, the other members of the family, they'd be involved in the care of that individual, and that too would be taken into account as part of the balancing exercise. So far as adult protection is concerned, we are recommending there that the individual should be safeguarded from abuse and neglect, and that where intervention is necessary, as of course it is on certain occasions, the least restrictive solution is that which is followed. So, in terms of assessment, we call this in place of assessment, we're again there suggesting a tiered approach, but this time it's 2 tiers. The first is that there should be a duty on local authorities to provide information, advice and assistance. And in relation to that, the local authority should then be able to set out what the universal services are, and should be able, through that process, to shape the market within its administrative area. And so far as that part of our proposals are concerned, that was one of the areas that the Dilnot report has said it is strongly supportive of. Of course, that approach won't meet everybody's needs, and there will be cases where individual assessment is required. And so far as that is concerned, what we are recommending there is that there is a low threshold, so there's just a single duty to assess based on the appearance of needs, where those needs can be met through the provision of services. There is, we are recommending, the position that if the service user refuses the assessment, as sometimes they may, consistent with the principle of individual well-being and assuming to know what's in their own best interests, a provision that the local authority can regard that refusal as then discharging their duty. As part of the individual assessment, we're saying, of course, you place the individual at its heart, but that's not sufficient. You must consult with the carer, where there is one, and of course the family, as I've already referred to, but as I've said, at its principle is clearly the service user. How all that is to be done we are suggesting is set out in new regulations, that's community care assessment regulations, and so they will drill down on the mechanics as to how it is to be done. But the key of an individual assessment is that it is to be proportionate, so that where you've got somebody whose needs might be met, for example, through phoning up and wants a grab rail in their home, that can be dealt with over the phone. There may be no need then to fill in lots of forms and many pages and lots of detail. But of course, for people who've got much higher level needs, that will be the position. And in relation to them, what we have suggested is that they would be entitled to a support and care plan. Again, the name may change because through consultation, one of the messages that came back was, well, this is very old-fashioned to be referring to these things as care plans, and that may be right. But that's obviously for the government to work out. I mean, that's just all in the name. But where you've got a more detailed assessment, the essence is the individual will be entitled to a written care plan, and of course what is there set out will result in an individually enforceable right. Now, what about the eligibility for services? What we have suggested is that there should be a single eligibility framework for all services, and that will be set by the government. We have left it open so that if the government wants to step in, as the Dilnot Commission are recommending they should, and set national eligibility criteria, then they can do so under our recommendations. So far as we're concerned, we've just reflected the current situation, which is that councils are to set eligibility criteria. But, as I've said, if the government decide otherwise and there should be national eligibility criteria, then our framework, legal framework, allows for that. So far as the eligibility framework is concerned, then that would be set out by the government in regulations, and as I've indicated, once the individual has been assessed and the support plan has been devised, if those needs are then not met and services not provided, then you've got an individually enforceable right that would be enforceable through judicial review and through the courts. Now, as to carers, what we are suggesting there is that there is a single freestanding duty on the part of a local authority to assess all carers where they are providing care to another person and where they have the appearance of need. So the current requirement, which is that the duty on the local authority will only arise where the carer is providing substantial and regular amounts of care, is no more. It's based on the appearance of need only, and there is no need to request an assessment. What we have recommended also is that there should be a mandatory eligibility framework for carers services and the duty to meet eligible needs for carers. So, and so far as the definition of those, we envisage that will follow the same sort of format as would be required for the service user.